What is going on YouTube? I have been dealing with disc pain for almost 2 years now. A small disc bulge in my S1, L5 area, and brutal sciatica in my glute. And the sciatica has really been the kicker for me. About 2 years ago, I was at work, I lifted something up and pulled something the wrong way, and ever since I've been a mess. I waited 9 months to get an MRI here in Canada, and that's when they said, okay, you have a small disc bulge. I did physiotherapy for about a year. I seen acupunctures. I've had neurofacial reset or rapid neurofacial reset, chiropractor, acupuncture, Chinese medicine woman, anything that I could to try and get it better, and nothing really worked. And probably about, I don't know, a year into it, I thought, well, what can I do? Maybe I'll start day trading. I'll try the day trading thing, which that's a whole nother video. That didn't work out. But I did get comfortable sitting. When I first got injured, I couldn't sit. I'd try and sit down, and I couldn't sit, so I was standing all the time. And then at some point, something changed and allowed me to sit. And then I started getting comfortable sitting. Now, I never sat for more than 20, 30 minutes at a time. I'd get up and move around, but when I did get up, it hurt to walk. So now here I am 20 months later, and the problem is walking and standing, really standing. If I try and stand still for 10 minutes, not even a couple minutes. So I've already been out here for a bit walking around, and my sciatica is bugging me now. I shot a little video earlier, but I did it on the vertical instead of horizontal, so I'm kind of redoing it here and just winging it, right? So I've been dealing with this. I've seen all these professionals. They've all suggested surgery, but the thing is, my MRI showed I have a small disc bulge. But I guarantee you, any of you that are over 20 years old, if you have an MRI, you're going to show you have a small disc bulge or some degenerative disc disease or something along those lines, because nobody has a perfect spine after living through our teenage years and all that stuff, right? So, like I said, they said 75% of the people that have disc bulges have no symptoms. So, which has kept me from getting surgery, because I'm like, well, how do they know that that is actually the problem? How do we know that this small disc bulge that you say is small, there's my beehives back there, is what's causing the problem? I feel like, and I'm sure a lot of you guys can relate to this, that it's glute pain, piriformis syndrome, or what do they call it? Something gluteal syndrome. And, but the doctors say, no, it's not. Some people, their sciatic nerve runs right through their piriformis. I think it's like 15% of people. And the doctors say, no, it's not. They just assume it's not, which makes it frustrating, because everything is textbook. All these doctors and these professionals, it's textbook. They see the MRI, they say, oh, there's a disc bulge, there's your problem. But it's not always the problem. So my new current physiotherapist, we're trying new things with, and I think this is how we're going to beat it, and this is how we're going to fix it. He's saying that it's the nerve is adhesed to the disc, and that I need to separate it. And your nerve can slide like an inch up and down inside there. So, but it's trapped. And he said if you try and rip it away, it's like peeling off a scab on a wound, right? How's your wound going to heal if you keep picking at the scab? So every time I do something that hurts it, it's like starting over again. So he tells me, listen, if you feel it getting to a level 3, stop what you're doing and get down on the ground and stop it from hurting. Now for me, I'm fortunate that if I lay down on the ground, that my pain melts away. If I'm in bed or I'm laying down, I don't have any pain. And I understand some of you people, and my heart aches for you guys, because I know what I'm going through. And if I couldn't get any relief, I don't know what I would do. So I understand the people that, they can't sleep, they can't lay down, they're in pain, or maybe have erectile dysfunction, or what do they call it, cognitive issues. Those type of people, I'm very fortunate and blessed that I'm not in that situation. My pain is brutal. Like, don't get me wrong, I can't stand for more than a couple minutes normally, without getting this irritating nerve pain. And if you've watching it this far, you probably know what I'm talking about, which also makes it frustrating for people that have never had it. You know, I was working with a kinesiologist one time and I said, "Do you ever have any nerve pain?" And he says, "No, I've never had nerve pain." I said, "What about a toothache?" He said, "No." I said, "Do you have any fillings?" He said, "No." I said, "Then you can't relate." You know, the best way to describe it is if you had one of those metal fillings in your teeth and you took a piece of metal or tinfoil and touched it to that whoa, right? That's the feeling. And to me, it's like my glute, once it starts arcing. So if you picture a wire that's arcing and sparking, so once it starts going through the day, you know, I get up and it starts sparking, then it irritates that nerve. And for the rest of the day, it just, you know, it gets irritated so easy. So I can blabber on for probably 3 hours about, you know, the professionals I've seen, the supplements I've made, and the exercises I do, but I'm not gonna I just want to make a short introduction video for me. My goal is to heal this, right? I'm not looking for a magic pill, and I'm not looking for a quick surgery way out. I want to prove that this can be fixed. So when we try and look up, you know, can it be fixed? You know, there a lot of everything points to go get surgery. And when you try and find people, well, did people heal after 2 years? It's hard to find them, because I think when the people beat this, they just disappear, right? Their problem's solved, and they're not in the forums anymore saying, "Hey, I'm better now." So we don't get that feedback. And most people, it does heal on their own. Like I said, if you go to a doctor, or you go to your chiropractor in the beginning and you say, "I have, you know, my back's hurting and I've got sciatica," most of it's going to heal. I think they say like 70% will heal on its own within the first four to 6 months. So you can go to him and he can tell you to go do your glute bridges and, you know, your clamshells or whatever, your dead bugs or your cat cows, and do those, and then you're better in a few weeks or a month, and you're like, "Oh, he fixed me. He's a genius." But that was your body that fixed itself. And I believe my body can fix itself. And as we get older, it takes a little longer. I did have a sciatica probably 20 years ago for like 9 months, and it just went away one day. And I tried everything, and one day it just went away. Well, now it's back. I don't know if it's the same thing. I'm sure if I took my MRI, it wouldn't be much different than it was then. But obviously, you know, it's come back. So I'm just trying to heal it and prove that we can heal it, and hopefully make a community and have other people that are going through the same things. You know, if you guys can comment, if you're going through this, have you been through it? You know, have you healed yourself from it? What are you doing? What has helped? Maybe you've done something that I haven't thought of, and I'm willing to try it. Eventually, I'm going to post the videos like on exercises that I'm doing, what supplements I'm taking to try and help my body heal it. You know, I've just stopped smoking cannabis because I was a chronic cannabis user, but unfortunately, cannabis restricts your blood cells, and it makes our, I don't know if it was the platelets, but it makes your tissues tacky and sticky. And with a nerve that's trapped, I need as much lubrication in there as I can. So I'm doing what I can to try and fix myself. This video is already at 8 minutes and 35 seconds. I haven't said half the stuff I wanted to say. Most people have probably already left here, but for those of you that are here, hopefully you'll join me on this journey, because I really do want to fix this issue. And I'm hoping, my goal is that you'll watch this video and then you'll be able to fast forward through a couple videos, and you'll say how I healed it, and it did heal, and it'll give you hope that we don't have to get surgery, that we don't have to, you know, be on painkillers. I'm not on anything right now. I was taking NSAIDs, naproxen for a while, but my current physiotherapist told me, stop taking it. Let's have the natural inflammation. Let's feel what's going on. And when I stopped, I've been with my new physiotherapist now for about 3 weeks. And I stopped the NSAIDs, and it was a rough week. And actually been a rough 3 weeks, but I've got more range of motion. That was the biggest problem, is I couldn't get my legs straight. And now I've got a lot more range of motion than I had before. So he says you might have more pain, but more range of motion. Let's just keep going, right? So this is not going to be an easy journey. It's going to be a tedious, painful journey that I'm willing to go through if it takes another year or two to get better on my own. Because, you know, the surgeon, he wanted to, when I first went to him, he said, let's go get a diagnostic done in your S1. We'll do an injection and see if it helps. If it helps and we know that's the problem, then we'll do surgery. So I had the injection, it didn't help, and he said, okay, well, we'll do surgery anyway. Let's do discectomy. And then, no, first he suggested a discectomy. After the injection didn't work, he said, well, let's do a fusion. And I said, hold on, fusion? How do we go from discectomy to fusion? He said, you're right. If we do a fusion, then we can't do discectomy, but if we do the discectomy first and it doesn't work, we can still use a fusion. But I thought, well, if I don't do anything, and I keep doing physiotherapy and let my body heal itself, then surgery is still an option later, right? So that's where I'm at. I don't want to cut the disc out. My current physiotherapist says, you know, we can do this. We just got to get that adhesion gone. And so that's where I'm at. I'm going to take, you know, the next year or however long it takes, and I'm going to give you videos of what I'm doing, what's helping, what's not helping, the supplements that I'm taking, what I'm going through, and yeah, hopefully some of you guys can join along with me. I'd like to eventually have a point where there's a community, you know, where I can go live and we can have a chat and, you know, have 10, 15 people in the chat. We can all discuss what we're going through, because nobody knows. It's unfortunate, you know, I can walk around right now and my neighbors see me and say, he looks perfectly fine. Even right now, you're looking at me going, he's perfectly fine. I a little overdid it a bit right now, and now my sciatic nerve is grabbing me. I'm sucking it up and I'm dealing with it, but it makes me short and irritable. You know what I mean? I know you know exactly what I mean. If you've been watching this for 11 minutes, you know exactly what I mean. So I'll end it right now, and maybe I won't even post this. Maybe I'll redo it, but I should just post it and see where it goes from here. Like I said, regardless, I'm going to post the videos of the exercises that I've been doing and the supplements that I've been taking, and now I'm getting repetitive, but you know, anything that we can do to make this get better. And in the end, hopefully I can say this is what worked, and then everybody else can watch this and say, hey, I can beat this without surgery, right? Because I'm sure it can be done. Anyway, I'm going to end it for now. If you've been watching this long, I appreciate you. Thank you very much. And, you know, I understand what you're going through, and maybe you're going through worse than me, because I hear about these people that just can't get comfortable. And my heart goes out to you, because I know how bad this has affected my life, right? So luckily I've been able to stay away from any of the opiates or any of those, you know, because I've known too many people that just get addicted to that. And I have an addictive personality, so I don't want to be taking any of those. So anyway, if you have any words of encouragement, or if you want to tell me, you know, what you're going through, how long you've been going through it, maybe you went through it and it healed, anything like that, maybe something that I could try that I haven't thought of, that would be awesome. I look forward to hearing something, and I'm going to make new videos from here. So until then, guys, thank you very much. I appreciate you guys taking the time to watch this video.